There's a common belief that the older we get, the more medical tests we need. Annual scans, full blood panels, cancer screenings, heart imaging. The idea sounds logical. Catch everything early and live longer. But here's what many people don't realize. After age 75, the equation changes. As a doctor would explain, medicine is not just about finding disease. It's about balancing benefit versus harm. And in older adults, certain routine screenings that once made sense can begin to create more problems than they solve. Why? First, many conditions detected through screening grow very slowly. Some cancers, for example, may take 10 to 15 years to become dangerous. At 40 or 50, that matters. But at 75 or 80, especially if someone has other health conditions, treating something slow-growing may never improve lifespan and could reduce quality of life. Second, false positives become more common. A small shadow on a scan, a slightly abnormal blood marker. That can lead to biopsies, invasive procedures, hospital stays, anxiety, and complications, sometimes for something that would never have caused harm. Third, the body's resilience changes. Recovery from surgery is slower, sedation carries higher risk, even routine procedures can trigger confusion, weakness, or loss of independence. Major medical organizations like the U.S. Preventative Services Task Force and the American Geriatric Society have emphasized that screening decisions after 75 should be individualized, not automatic. This doesn't mean stop caring. It means shifting focus. Instead of aggressively searching for silent disease, doctors often prioritize mobility, cognitive health, fall prevention, medication safety, symptom-driven care. The goal becomes maintaining independence and daily function, not chasing every abnormal number on a lab report. Another important concept is life expectancy versus chronological age. A very healthy 76-year-old who walks daily and manages their conditions well may benefit from certain screenings. A frail 76-year-old with multiple chronic illnesses may not. That's why blanket rules can be misleading. In the next sections, we'll walk through 5 specific medical checkups that many doctors carefully reconsider after age 75, and why the risks, in some cases, may outweigh the benefits. Because sometimes the most responsible medical decision is not to test more, but to test smarter. For decades, colon cancer screening has saved lives. Colonoscopy can detect and remove precancerous polyps before they ever become dangerous. It's one of the great success stories of preventative medicine. But after age 75, the conversation becomes more nuanced. Organizations like the Centers for Disease Control and Prevention and the American Cancer Society generally recommend individualized decisions about continuing colon cancer screening beyond 75. Why the shift? Colonoscopy is not a simple test. It requires bowel preparation, sedation, and insertion of a scope through the colon. In older adults, the risks increase. Dehydration from bowel prep, electrolyte imbalances, bleeding, perforation, a tear in the colon wall, complications from anesthesia. Even small risks become more meaningful when the body is more fragile. There's also the timeline issue. Colon cancer typically develops slowly. If a new polyp is found at 76, it may take 10 to 15 years to become life-threatening. For many older adults, other health issues are statistically more likely to impact lifespan. That doesn't mean no one over 75 should ever have screening. If someone is exceptionally healthy, has never been screened before, or has a strong family history of colon cancer, a doctor may still recommend testing. But the decision should be personal, not automatic. Non-invasive options like stool-based tests are sometimes considered instead of colonoscopy. These carry less procedural risk, but may still lead to follow-up procedures if results are abnormal. The key question doctors often ask is, will this test meaningfully improve this person's quality or length of life? If the answer is uncertain, it may be reasonable to stop routine screening and shift focus to symptom-based evaluation, meaning testing only if there are warning signs like persistent bleeding, unexplained weight loss, or significant changes in bowel habits. After 75, prevention doesn't disappear, it evolves. The goal becomes protecting strength, comfort, and independence, not just detecting every microscopic abnormality. PSA testing measures prostate-specific antigen in the blood. Elevated levels can suggest prostate cancer. For men in their 50s and 60s, PSA screening can sometimes detect aggressive cancers early. But after 75, many doctors become cautious about routine PSA testing. Why? Prostate cancer is often very slow growing. Many men live with it for years, even decades, without symptoms. In fact, studies have shown that a large percentage of older men have small prostate cancers that never become dangerous. Routine PSA testing can lead to a cascade: slightly elevated PSA, repeat testing, biopsy, diagnosis, surgery, or radiation. Those treatments carry real risks: urinary incontinence, erectile dysfunction, infection, surgical complications. According to guidance frequently referenced by groups like the U.S. Preventative Services Task Force and the American Geriatric Society, routine PSA screening is generally not recommended in men 70 and older because the potential harms often outweigh the benefits. Another issue is overdiagnosis. Some prostate cancers detected by PSA would never have caused symptoms. But once diagnosed, many patients feel pressured to treat them, leading to side effects that may reduce quality of life without extending it. For a healthy 76-year-old man with a long life expectancy and strong personal preference for screening, a doctor may still discuss the option. But blanket yearly PSA tests are no longer standard for most men in this age group. The focus shifts towards symptom-driven care: difficulty urinating, blood in urine, bone pain, significant changes in urinary flow. If symptoms appear, testing is appropriate, but routine screening in symptom-free older men often reconsidered, because preserving dignity, independence, and comfort may matter more than diagnosing a cancer that may never cause harm.
There's a growing trend toward executive health scans, full-body CT imaging marketed as a way to detect hidden disease early. It sounds reassuring, but many doctors strongly discourage routine full-body CT scans in healthy adults over 75. Here's why. CT scans expose the body to radiation. While one scan may seem small, cumulative exposure adds up. More importantly, these scans often detect incidental findings: tiny nodules, cysts, or irregularities that are benign but trigger follow-up testing. This can lead to repeat imaging, biopsies, hospital procedures, anxiety. Many of these findings never cause symptoms, but once discovered, they are hard to ignore. Similarly, cardiac stress tests are sometimes ordered in older adults without chest pain or shortness of breath. However, professional societies like the American College of Cardiology advise against routine stress testing in asymptomatic individuals. Why? Because abnormal results in people without symptoms often lead to invasive procedures like angiograms or stent placement, procedures that carry higher complication risks in older adults. Testing is powerful when symptoms guide it. If someone experiences chest discomfort, unexplained fatigue, or shortness of breath, evaluation is essential. But screening without symptoms can start a chain reaction of interventions that may not improve survival and may compromise independence. In geriatric medicine, there's a guiding principle: don't look for trouble you don't need to treat. After 75, protecting functional ability, walking, thinking clearly, staying socially engaged often matters more than identifying every structural abnormality on a scan. Technology is impressive, but wisdom is knowing when not to use it. Mammograms have reduced breast cancer deaths for many women between 50 and 74. But beyond 75, routine screening becomes less clear-cut. Organizations such as the American Cancer Society suggest that screening decisions after 75 should depend on overall health and life expectancy, not age alone. Breast cancers detected at older ages are often slower growing. If a tumor is found at 78, it may take many years to become life-threatening. Meanwhile, treatment can involve surgery, radiation, hormone therapy, hospital visits, fatigue, and recovery challenges. False positives are also common. Additional imaging and biopsies can cause stress and discomfort. If a woman is in excellent health, active, and expected to live more than 10 years, continuing screening may be reasonable. But for women with multiple chronic illnesses, frailty, or limited life expectancy, routine mammograms may offer little survival benefit while increasing medical burden. This is not about neglect, it's about prioritization. After 75, healthcare often shifts from aggressive disease hunting to comfort, function, and quality of life. The most important checkups at this stage may not be cancer screenings at all, but fall risk assessments, medication reviews, cognitive screening, strength and balance evaluation, social connection support. In other words, protecting the life someone is living now. Because medicine at 75 and beyond isn't about doing everything, it's about doing what truly matters.